Good afternoon and welcome to the Restart podcast and webinar in association with Prestidge Group, brought to you with Arabian Business. Now, for any parent, if you break it down, all we really want for our children is for them to be healthy and happy. Now, in the past 12 months, lots of us have been focused on healthcare, lots of us have been focused on the pandemic. But for many families in the region, there is an extra worry in terms of genetic diseases. There are, in fact, more than 241 genetic conditions present in the Arab region. So the UAE is leading the way in terms of treatment and research in that area. And today I'm delighted to be joined by experts to unpack what this means for family and what is being done in the community at large to help families affected by genetic diseases. Firstly, I'm joined by Marwan Abdulaziz, who is the CEO of Dubai Science Park, and Karim Smaira, who is the CEO of Genpharm, which is a specialty pharmaceutical company focused on rare diseases. And if we're very lucky, we will also be joined by Dr. Maryam Matar, who is the founder and chairperson of the UAE Genetic Diseases Association. Gentlemen, welcome to the podcast and webinar.
Thank you, Scott.
Okay, so look, this is a topic that goes right to the heart of families, and for those affected, this can cause real heartache. To start with, I'll bring you in first, Karim. Tell us really, what is a rare disease? What is a rare genetic disease? How does that differ from more widespread medical conditions that we might be more familiar with?
Yes, in fact, rare diseases have been defined by the FDA as any disease that has less than 200,000 patients, or 200,000 patients and less. Now, the difference between these rare diseases and others is that most of them do have a genetic origin. Many of them, in fact, the vast majority, are pediatric diseases. And unfortunately, most of these children will not be able to see past their age 5. So they have a very high societal burden. They do have also an economic burden because these are normally degenerative diseases. The health situation of the patient deteriorates pretty rapidly, and the parents really need to make sure that they have the right environment to take care of the child. Now, when we speak about the Middle East and North Africa region, for that matter, we have 28 million rare disease patients in our region. Globally, there are more than 300 million patients living with a rare disease. So the community, in fact, of rare disease is a pretty large one. If you consider this on the basis of the US population, every 1 in 10 US citizen is suffering from a rare disease.
I'm going to just invite as well the audience tuning in. If you've got comments or questions for our panels today, particularly if you're affected by genetic disease or you want to ask our panelists any questions, please feel free in the chat box and the comment box to ask some questions, because these are the guys to support. Marwan, I'll bring you in here. I mean, Karim, we talk about a kind of a social burden. But I think most of us as family men look at this as a responsibility, something we all take very, very seriously. Talk about the work of Dubai Science Park. How much genetic research is happening there? What's the primary focus?
Well, I mean, as Dubai Science Park, our role is to be an industry enabler, to be providing not only infrastructure, but also the right ecosystem components for companies to be able to set up their company, to set up their operations, to do business, to do manufacturing, research, etc., whatever it is that supports their establishment and their growth. We have, up until today, we have around 400, or I would say more than 400 companies part of Dubai Science Park. But in the area of rare diseases, we have around 10 to 12 companies that are, have their business is in rare diseases. And we have obviously learned a lot from them in terms of, what are the things that would need for them to grow their business, and also how is it that they can do more than just representing the companies. We have had many discussions with them to encourage them to do manufacturing, to do some, to localize their distribution centers, and also work with the local universities to do some R&D projects. So we're very much involved with these companies on different levels, and because it's such a big problem here in our region.
Can you unpack that a little bit more for me? Like you say, it's a problem specific, in this region. I mean, as a father, I'm shocked by that. Karim, you're saying many of these children don't live beyond 5 years old, and I've got a 5-year-old daughter right now. So, I'm very, feel myself very fortunate having this conversation that she's happy and healthy. But tell me more, and I'll come back to you, Marwan, first, and then I'll come on to you, Karim. What is the size of the problem here? What is the size of the issue?
I don't have the number specifically, but I know that for the population, it's not very rare. So the common saying is that rare diseases are actually not rare in the GCC region, and that's for a couple of reasons. One of them, and I think that's the biggest problem, is interracial marriages, and cousins getting married, things like that. That is one of the issues or one of the causes of the problem. But also, I remember many years ago, about 15 years ago, when I wanted to get married, I was asked to do a genetic test to make sure that my wife is not a carrier of the thalassemia. And I was happy that she's not, and we were both not, and we were able to get married. Yeah. Whereas my brother, for example, he's a carrier of thalassemia, and he had met someone who was also a carrier, and they were not able to get married. So, sometimes it is policies like this that makes a huge difference. So if we look back, 20, 30 years ago, the absence of this policy would mean catastrophic problems for not only the families, but also the entire health system.
How far have we come? Karim, honestly, I'm going to bring you back because I know you've got some figures and some data and some research. But how far have we come down this road? I mean, we're here already, and you say we have families who were affected by this still today. Has there been much progress in terms of education? The things that awareness and education can help with before we even get into the medicine.
Yeah, absolutely, and I think this is Scott. The key word is education. And when we speak about education, I mean education amongst the general public, the general population, not only among the physicians or the clinicians sphere. As Marwan was mentioning, it's so important to do these genetic tests before you marry. And sometimes the challenge is when you have societies like ours, where consanguinity rate is very high. Because of the nature of the structure of our society, which remains in many instances tribal, it's very difficult to convince people to move away from these traditions if it is necessary to avoid having some of these rare diseases. And to that point, I mean, the biggest challenge we face, or the families of rare disease patients face, is really the lack of education, in particular when the early onset of symptoms appear, and how do you actually come to a confirmed diagnosis. And I'd like to stress this very important point, because if I take the example of one of the diseases, such as Duchenne muscular dystrophy, we know in Europe and in the US, the child is diagnosed usually around the age of 3 to 3.5, while in our region, the diagnosis is confirmed around the age of 8 or sometimes 9 years old. Now, for a disease that has a treatment, when you are losing 4 years of a window of opportunity to treat and to control the progression of the disease, this has a significant impact on quality of life, on future prognosis, and on life expectancy. So diagnosis is really one of the key factors that we work on. And we do a lot of educational events with families, with physicians, to try to really make sure that the patients that are suffering from rare disease are moving quickly from the primary care system, whereby they are visiting the GPs and the pediatricians. And sometimes, because of the lack of awareness, the families can lag for a very long time before they reach the expert. So we try to encourage and work very closely with the scientific societies of family medicine, GPs, and pediatricians to tell them that if they were to see several typical signs and symptoms, rare diseases, that they would be transferring these patients to the expert sooner than later, so that they can get the proper diagnosis and the right treatment.
Thanks. I'm delighted to welcome Dr. Maryam Matar to the conversation as well. Dr. Maryam, thank you for joining us. Technology has blessed us with your presence. That's great to welcome to the panel.
Thank you very much. It's a great pleasure to be among all of you. Hello, Marwan, Karim, and thank you very much for the invitation.
No problem.
So, Karim was just, Marwan and Karim, we were just talking about the importance of awareness, Dr. Maryam. In particular, Karim was talking about the lag sometimes in this particular region compared to, say, the US in diagnosis, particularly in children with some genetic diseases. You know, sometimes in the US it might be 3 years old, but in this region it's 8 years old. Community awareness is something that's very important to you, isn't it?
Indeed, indeed. Allow me in the beginning to welcome everyone, and especially who is sparing their valuable time to hear to us and think with us loudly. So when it's come to the region, I believe I always have a concept when I talk about this region. It's very essential to differentiate between United Arab Emirates and other parts of the region, because when we go back to the infrastructure, I believe it's not fair to compare United Arab Emirates to other parts of the region who is lacking a very basic, essential elements of the infrastructure when it's come to the awareness. And when we talk about awareness, I believe it's so vital to define the awareness level among the community, because the awareness among a physician is more essential and important than the awareness among the family who's acquiring that specific mutation or disorders. And the same is applicable to the decision maker, where they have to be aware about the economic impact and as well as a social impact of such disorders. So I do agree with Karim when it's come to the awareness, lack of awareness, but again, it is variable among all those three different levels in the community.
Marwan, you were talking earlier. I mean, we're going to get onto medical technology. We're going to get to treatment. We're going to get to that kind of thing in a moment in some questions. And I'd like to just take a slide to say, Patrick Maloney, thank you for your question. I will pose that to the panel in a moment or two. Marwan, tell us about what policymakers can do in this area and the public drive to drive scientific development and medical research. You really feel it's important that public policy is there, yes?
I would say that it's there, but there is a lot more to be done, and I see the last few years there has been a lot of foresight into ensuring that we solidify the position of the UAE when it comes to scientific research, when it comes to medical technology, and we have seen things that that I never thought we will see. Although those are things that we were talking in scientific circles, especially when it has to do with citizenship and the golden visa, for example. Because science does take time. Discoveries takes about 10 years. It takes a lot of money, and it takes a lot of foresight. So I think the current changes in policy that we have seen is really to the point and very, very necessary to be attracting the brightest minds, if you will. And we need to also acknowledge that in the Middle East, and this is according to the World Bank data, the number of scientists per million in the Middle East is I think the average is about 2,000. Whereas in other countries such as Finland, Sweden, is about 6,000. So the number of scientists that we have, in the entire region is also quite low, which brings us to the point that we need to, I think, talent and talent development is one of the very, very important points.
Dr. Maryam, can I ask you to expand on that point? I mean, more scientists needed. You've worked in this field with a number of different hats on, haven't you? So I mean, I'd be interested to get your take on what Marwan's saying there as a policy maker, and that need to bring more research, more talented brains to the table in this region around this subject.
Absolutely. Again, what Marwan just said, I would like to consolidate on his input. I do agree there is a tremendous development to the all the basic tools and elements which is needed to upgrade the whole service of gene therapy or genetic disorders management in the region when it's come to the scientists, physician, as well as the system. But again, as you mentioned just now, as a decision maker, I believe in United Arab Emirates, we were pioneer on different level. And
Mm.
again, talking from a local point of view, we found out that the best tool to enforce and manage a better quality of the life of those people who's affected with the disease is legislation. By
Mm.
enforcing a legislation, simply what you are doing, you are empowering other sectors of the whole chain to be empowered with budget, with human resource, as well as with all the new technology. So it's like a wave which takes with it all the necessary elements. And as Marwan said just now, in the past 10 years, there were a dramatic development in this area, and we are talking about United Arab Emirates.
Yeah.
And what brought the whole process to an extreme level when it's come to development, it's our new partnership with our colleagues in Tel Aviv and Israel. And when we
Okay.
talk about technology and genetics, in my opinion, they are the best available, suitable organization and a platform for us to adopt what they've done because of lots of similarity when it's come to the population numbers, when it's come to their budget, and specifically when it's come to the genotype. And when you compare the whole development in Tel Aviv, you cannot imagine. It's like, in my opinion, it is a heaven door open for United Arab Emirates with
Right.
all the commitment which we have from a decision maker, from the educational system in United Arab Emirates. And here specifically, I would like to mention a university in United Arab Emirates which is doing dramatically great when it's come to academia and research. It's Sharjah University Medical College. They
Right.
are aligned with very big international groups to come up with all those new technology. In addition to that, they are preparing a whole new generation of United Arab Emirates citizens and residents to be effectively involved in the first stage of the whole development till 2071.
Karim, I'll bring you in here. I mean, you're obviously within the private sector. Dr. Maryam talking about obviously kind of accessing the information and knowledge and data and research over in Israel. What do you see as the size of the market? What do you see as the size of the opportunity to do really, to make a real difference in this field?
Yeah, if you allow me, Scott, I'll just take a brief minute to comment on a point that was made by Marwan, which I find very, very helpful. And in fact, working in rare disease space, one of the frustrations that we have is usually the lack of scientific publications and epidemiology data coming out of the region compared to other regions. When you're looking to understand certain phenotypes or to understand certain disease within our population, with the exception of a couple of prevalent diseases, most of these rare diseases lack the scientific publications required that would allow us to, in fact, attract companies working on certain diseases to come and conduct clinical trials in the region. So we're always grinding to identify centers of experts and trying to identify a patient population that could benefit from participating in clinical trials. This was one key point that I wanted to mention. And when it comes to the policy part, I see a lot of progress happening over the last few years. And to Dr. Maryam's point, you see the GCC has in place for several of diseases, a newborn screening programs or panels. So when a child is born in the hospital, they're already tested for certain rare diseases. What is happening though with the advancement of technology and the approval of new treatments, the panel needs to be expanded. And to do that, you need to change legislation to be able to include these diseases. You need to be able to conduct clinical trials, which requires heavy investments and time. And I think this is where maybe private and public, as well as academia collaboration becomes very important so that these screening panels can be enlarged and these patients can benefit from an early diagnosis. Sorry, Scott, go on.
Okay, carry on.
So when it comes to the private sector question, again, we lack figures on a regional scale, but what I can tell you is the treatments of rare disease therapeutics globally has surpassed the $160 billion in terms of value. It keeps growing at a very, let's say, big rate of more than 13-14%, because of new patients being diagnosed and because of also new treatments being approved. In the region, what we do face is obviously these treatments are mostly expensive, so we have to be extremely careful with the selection criteria of patients, identifying which patient would benefit the most from these therapies, identify also the pharmacoeconomic data that would make the use of such therapies affordable and also logical for the Ministry of Health, because as you know, most of the rare disease treatments are covered or reimbursed by the public ministries of health across the GCC. So there is significant growth. There is significant challenge with the number of drugs being approved. There is a bigger challenge with the number of with the prices of these drugs. So we have to be very careful in which patients are put on therapy. We have to be careful in following up these patients, making sure that they are getting the optimum effectiveness or efficacy from these drugs, and making sure that there is no funding or resources going to waste.
Now, I'm just going to bring in Patrick Maloney's question. He's been kind enough to pose a question to the panel. And Marwan, I'm going to ask you to answer this one, if you can. Or at least I'll get your thoughts first. What are the panel's thoughts on direct-to-consumer genetic testing? Is there a worry about end patients' explicit consent and data? So what are your thoughts about that?
Actually, I was going to make a comment on what Karim was saying, that I think, just for the audience to make it, simpler, I think it's, a triangle of, what's happening in the industry. And, today with COVID and, diagnosis, the pathologists today are, they were in the basement doing tests and nobody knew about, what they were doing. But today, the pathologists are really driving healthcare, and they will become, I think they have become very, very important into how, tomorrow's healthcare will be shaped. So we are becoming better and better in diagnosis. So we are having a better and better understanding of ourselves, of future diseases, of mutations, etc. But that also generates a lot of data and information. So the biggest question today is, who should have access to that data? Is it me? Is it my health insurance? Is it the health system? How do we treat this information? And then the third element is treatment. So you get diagnosed, you have the information with you, your data, and then you have to be able to make a decision on the type of treatment. So I think this triangle is very important, that we understand it, and there is each part, I think, plays a very, very important role.
Dr. Maryam, I heard you agreeing perhaps there with Marwan. Let me bring you back on. What's your thoughts around that?
Yes, I believe here we need to bring in the whole discussion the precision medicine ecosystem. Precision medicine ecosystem, it's well-defined system where the whole concept is to empower the clinician to take the right decision in the right time as fast as possible. And I was so happy recently, last month only, there were a circular from Dubai Health Authority, but that no physician or a lab is allowed to do any genetic test without being referred from a physician or a genetic counselor who will be able to explain the whole report to the patient or to the physician who will take the decision. And I believe this element, it's a very solid part of the whole chain, and that itself will stabilize the whole process. When it's come to the patient right for the data, I believe it's so valuable to mention here. Today, we are so happy with all the great advance in gene therapy, in new pharmacogenomic concept of different disorders. And that was simply done that because we were able to access a specific and good amount of data for people who's having that disorder. And based on that, we had a better understanding about the mechanism of the disease. So we were able to identify or create the whole new type of treatment. So when it's come to the patient right, I believe, as Karim mentioned earlier, we do have a good legislation in place, and we are trying our best to have a better governance to the patient system, a patient information. But again, there is a good room for improvement in the whole chain. But so far in United Arab Emirates, we believe we are doing good, and I think what we are trying to adopt from all the international best practice, that helping us to be pioneer in all those new elements which we add to the legislation. And here I would like as well, if you don't mind, Karim, I believe, in my opinion, as a person who were in a decision maker, I don't think we need to change any law. What we need to do anything is to develop the law. We need to keep all those articles which was based on a specific need in that specific time. And we build on that according to the demand and the need from the end user or the service provider.
Well, Karim, I've got to bring you back here and ask you to respond to what Dr. Maryam said there.
No, I think we're thinking alike, because what I said is, for example, the newborn screening programs that are in place, which are good enough. What they need to be made, they just simply need to be expanded to include additional diseases for which there are now new treatments coming on board. And what you find is that until this happens, we are losing several years of, let's say, delayed diagnosis for a disease for which there is a treatment and the patients could benefit from that treatment. So if we were able to move a bit faster from a legislation standpoint to expand these newborn panel screening and include additional diseases, that would be very helpful, in particular for the patients.
Absolutely. And can I add to this point only, if you don't mind?
Please do.
Yes, yeah. So I do agree, and we do need to do a lot. But again, I always try not to be optimistic but I like to be optimistic based on a very solid ground. And we all were so happy to hear the news about the whole new gene mapping of UAE population, which was announced last week. And I believe with this step, which took us around 5 to 7 years to build all those required legislation, infrastructure, human resource, collaboration, having all the protocols in place, getting all the stakeholders in one place, I think that itself will help a lot to build a very constructive panel for a specific mutation, which is relevant enough to a good amount of the population. And when it's come to the rare disease, I believe in United Arab Emirates, we believe that this is one of the hanging fruits. As you know, we are a very young community. More than 62% of UAE population are below the age of 30. And we believe that this is a golden opportunity where we will be able to detect early and prevent any comorbidity or prevent any newly born children with such disorders. And I believe we are doing that. And I think we need to do more when it's come to the rare disease, and the whole concept of the national gene mapping. That itself will speed the whole process, and we will be able to have a panoramic view for all those genetic disorders, regardless if they were rare or common. And in my opinion, the rare disease internationally, they are not rare in United Arab Emirates. Simply, they are not known. And I believe those define rare disease internationally very soon, with our understanding of our gene makeup, it will be a common genetic disorders. It will not be a rare disease. And here where the whole insurance concept will come in, and they will be indirectly forced to cover the cost of early detection and management and treating those patients.
Will that be a massive step forward if that becomes something that families can access via medical insurance? I mean, Marwan, I'm going to bring you in here as the CEO of Dubai Science Park. I mean, Dr. Maryam there talking about the gene mapping project, which sounds like a huge step forward. But equally, for families out there, if all of a sudden they can access medical treatment through their medical insurance, that seems like a big step forward too, as far as communities are concerned.
100%. Of course. I mean, we need to acknowledge that, a lot of the people who live in the UAE are, have their medical treatments through their insurance providers, and insurance providers have their own limitations, and again, they don't have access to the data that Dr. Maryam was talking about. So I think when that is done, the playing field would be leveled, where everyone will have access to information to be making better decisions.
I'm going to ask you all a question, if you will, because this is the question I always ask of all of the panels that I'm ever in, and on behalf of the audience. Dr. Maryam, I'll come to you first. What's the question that no one asks you that they should ask you about this area?
Nobody asked me ever. Did my gene mapping? Do I know a bit, and I understand the whole, let's say, the genetic tree of my family from both sides, and what I was able to do, because I did that, and it helped me dramatically to improve a lot when it's come on the quality level, and especially epigenetic, where I was able, with a great tool of science, to recycle the whole biological age of my cell. I am 45 years old, but my cells are only 16 years old when it's come to the kidney and liver. And when it's come to my ovary, it's only 28 years old. And that itself took me 5 years to go through this program to be able to reach that level where I help my body to repair itself and recycle the biological clock in the other way.
I'm not sure I want to know how old my cells are. I'm feeling like they might be a lot older than I actually am. Karim,
yeah.
to you, what's the question that no one asks you?
Well, I'll tell you first, I am at the complete opposite spectrum of what Dr. Maryam just said, and this links to the question that Patrick had for us. I was recently having a discussion with one of the genetic references in the US, and we talked about personal genetic testing and access to personal information. And in my case, I just refuse to do my genetic mapping because I don't want to know what are the risks that I might develop or that I have for my old age. With this genetic mapping today, you're able to identify certain risk factors. And the question is, if I was told today that I have a good chance of developing Alzheimer's or Parkinson in my older age, I am not too sure how this will impact my current lifestyle, or considering that there are no effective solid treatments today for Parkinson or Alzheimer, I'm not really sure I want to know that. So I stay away from these personal genetic.
Karim, you're a CEO of a private company. I mean, I'm going to challenge you on this. I think Dr. Maryam's absolutely right. I might be a bit light-hearted about my genes, and we can clearly see that my follicles are much older. But you run a business. You're often talking about risk, and managing risk and looking ahead so you can bring in strategies. I mean, I'm surprised to hear you say that.
Yeah, absolutely. I mean, this is it. It's a personal choice, and some people are able to live with that risk in the back of their mind, waiting for it to happen. I prefer to go about life the way it is right now, and
I think we need to have another panel of discussion.
Absolutely. I mean, this is excellent. I mean, look, clearly, Marwan, your genes are younger than mine. But I'm interested in your perspective on this one.
Right. I mean, I think, I would be with Karim a little bit, not 100%, not 100%.
He's sitting on the fence.
I'm a big believer in prevention.
Yeah.
I have. In my family, there's a lot of diabetics. I've seen my father really manage his health really well and been able to stay away from diabetes. So I've seen it in front of my eyes that, even if there is, a certain disease in the family, you can still manage it. You can reverse it, like what Dr. Maryam has done. I definitely believe that. in reversing and switching on and off the cells, as you know.
I mean, absolutely fascinating. I don't think I could switch my hair follicles back on, but there we go. I made peace with that a long time ago.
I have a good news for you. I have a good news for you, Scott.
Yeah.
And even for Karim.
Go on.
I believe we as a human being, we need to take the opportunity. And we are so lucky in compared to other people who was around 10 years ago. And with the advance in medicine, especially, let's say, specifically Alzheimer, which Karim was worried about, that disease in particular, there is a dramatic and promising result with the stem cell and with high dose of vitamin B12, 1 and 2 and 6, and a specific amount of copper and zinc, where you can take it early enough before the age of 30. And you can even extend the whole process of acquiring Alzheimer. Instead of having it in 50 and 60, you might have it in 90 by only taking these small preventive tools around, which is available, accessible, and affordable. So, and here, I think I need to mention that in United Arab Emirates and globally, we are advocating for a new law where any physician is not allowed to screen any specific individual for a mutation where the treatment or the management is not available and not affordable by him. And by this, here where we can maintain a good legacy and governance toward the patient care and his quality of life. I think by this, that's where we can take the science in the right place and do it, an applied science where it can change the life of people, not only letting them suffer and think about the consequences of a specific mutation, which involuntarily they acquire it either from one of the parents, or additional to that, with a better understanding of epigenetic, we know that me as a human being, I can acquire specific genetic disorders by misbehaving with my food, misbehaving with my sleep, misbehaving with my activity. So I can blame only myself. And if it happens that I acquire a mutation which increase my risk for diabetes, hypertension, cardiovascular, still I am fully responsible to maintain these mutations switch off till the end of my life by acquiring all those and having a good awareness about all those factors which can switch this mutation to express itself as a disorders which might end as a disease.
And I agree with this. Screening for treatable diseases, this is where I would feel better. I wouldn't mind screening myself for treatable diseases. But to give the example of Alzheimer's, we know in the pharmaceutical industry, this disease or this indication is called the black sheep of the industry, because every single trial that has been performed in Alzheimer as of today has failed its primary endpoint to meet its criteria for approval. And that's why, in fact, we don't have yet any specific treatment approved for Alzheimer. But as Dr. Maryam said, and this is where my concern was, if I was to be screened for treatable diseases, then of course I would have no problem. But to be told that you're going to have a disease that you can't treat is where some people, including myself, might have doubt on the usefulness of that information in that particular time.
So here's an interesting question for you then, Karim. As the CEO of a pharmaceutical company that has scientific talent, knowledge, brains at your disposal, there hasn't been a breakthrough yet, as you perhaps say. You are then screened and you find out that you have this. Aren't you just going to tell your guys and girls to actually go and research this? And maybe because you know about it, you're the guys that get the breakthrough there. I mean, this is kind of going back to, I learned, 99 ways not to create a light bulb, and then finally I create a light bulb. Isn't it something where the knowledge and the awareness might actually push things forward?
Yeah, that's Scott. That's a very good question. Unfortunately, in our case, we don't do any R&D. So I would have to count on my colleagues and other companies doing R&D. But to your point, I can mention to you few examples of rare disease that had no treatment. Mm-hmm. And in fact, the parents who were scientists were the ones that put into place and on the rail the scientific programs within companies that led to the creation of drugs and treatments for their kids. And I can only, mention to you, there's a movie, I forgot the name of the movie now, but it reflects a real life story. And that was played by Harrison Ford, if you remember, where he was working in a lab that was conducting a clinical trial for a disease that his kids had. And the lab decided to shut down that research program. And he basically, snuck out the samples from the lab and took them home. And because he was a doctor, started administering the drug to his kids, and saw a tremendous result. So he decided to form a company around that program himself and go out and get funding. And today, I'm not going to name the company, but today that company has approved drugs and is a NASDAQ listed company and is one of the leaders in the rare disease space.
And it's annoying because I almost remember the name of that movie that you're talking about. I can't quite remember it, but okay. I'm just going to pause briefly because we've had a question again from the panel. Thank you, Fatima, for sharing this. Basically, she's asking if we can put a light on muscular dystrophy and the issue around that. So I'll come to Dr. Maryam first, and then maybe back to you, Marwan. But how big an issue is muscular dystrophy, and what's being done around that area?
Muscular dystrophy, it's unfortunately, it is not uncommon in United Arab Emirates. And so far, we were able at least to identify some specific families and patients through those patients to identify the type of that mutation. And what makes muscular dystrophy on the top of the list of all those genetic disorders to be to take the opportunity for any new gene therapy, because it is a localized mutation on X chromosome. And to have this specific area in X chromosome, that helps a lot to have a target gene therapy. And additional to that, what makes it more understandable, and right now I would like to recall one of our heroes. His name is Abdulaziz. He is 28 years old, an Emirati who was diagnosed with Duchenne muscular dystrophy, and he's one of our hero and ambassador in UAE Genetic Disease Association. Right now, he's preparing for his PhD degree from London University in Dubai. So for him to reach that level, that is clearly a good indication about the infrastructure service which is available for this particular type of disorder, at least to maintain a good quality of life. But again, we need to do more than that. And when we talk about Duchenne, specifically Duchenne muscular dystrophy, unfortunately, this lovely baby will be born quite healthy. And the mother and the family, they won't be able to have any indication or red flag which tell them this baby is having the disorder, unless by the age of 4, the baby will not be able to walk or he will have a huge cough. But again, here I will bring Karim's point. When it's come to the awareness, the physician who usually the pediatrician right now for the past 5 years, they have much better understanding and tool to identify and diagnose the patient early enough when it's come to a specific type of disorder. And this is available and it's covered by the insurance. I'm not talking about genetic disorders, a genetic screening, but other tests and medical screening. So when it comes to Duchenne muscular dystrophy and other type of muscular dystrophy, they were a very successful cases and the medication is available, but unfortunately it is quite expensive for that patient to take it. So the way we approach the insurance, I simply do a specific calculation, which I learned during my leadership program in Sheikh Mohammed University, that you need to change the language when you talk to different level of the community. So when I go to the decision maker, I don't talk about with all those medical terminology. I try to talk to them with a number. So in case of this patient will be born with this type of muscular dystrophy, and he will live till age of 16, you as a country will be paying more than 20 million dirham to manage his case, not to treat his case. While when it's come to the therapy and treatment, by less than 3 million, you will be able to treat this patient and improve the quality of his life dramatically. And this is one way which was very successful so far with many patients. And again, when we talk about United Arab Emirates, it's not fair to compare it to other regions Because in United Arab Emirates, the whole chain of patient protection and care is completely different. We have a specific organization in United Arab Emirates, apart from insurance, apart from the government sector, who financially come forward and sponsor the treatment for those patients. But again, it is done case by case. There is no legislation, there is no insurance company who can come forward and accept any way of managing or covering the cost of that patient.
That's fascinating. I'm going to ask Marwan there as well. It seems like, and Karim, honestly, we'll bring you back in. Dr. Maryam's there talking about, it's almost like a bottom line, the business case for doing the right thing in this place, for treatment rather than managing, for research. There's real financial economic benefits in the long run for us to really advance in that area.
I mean, for sure, you're able to, justify the case for it. I think, with the information that you have available, for decision makers. But again, each and every disease, I think, is different, and because of rare diseases are rare, it's very difficult to be able to say I'm going to do X for a certain disease, and there are so many of them, and they all, affect children or adults in a different way. I think it's hard to zoom in and say I'm going to do this for this type of a treatment. But I think we're getting there. We're able to, collect better information, do earlier diagnosis, and make and take decisions at the right time rather than waiting for it.
Now, I haven't asked you yet my magic question of what's the question no one asked you, Marwan, and what's the question I haven't asked you yet that you want to answer?
Right.
Sorry, Karim.
So the question that I always get is whether I am a scientist, because I work in Dubai Science Park. I talk with all companies. I understand what they do, and my answer is no. I am not a scientist. I never studied it. So the question that I'm never asked is, why haven't I studied science, right? And this goes, really way back when I was in primary education, and I simply was not able to connect science with the real world at that time. When I was a small kid, I was not able to see the things that I was taught at that time, to connect it with the real world, and I thought it was something of a fantasy, to be honest. And this is why I chose not to pursue it. But now that I am in science, working with scientists, I think it's a very fascinating sector.
Karim, you've been patient, and I'm going to kind of bring the debate to a bit of a close. I could talk to you guys all night about this. But if we look forward to 2021 and we look forward to what's on the horizon, what's the thing that excites you most from a kind of, particularly from a private sector perspective? What's the thing that excites you most about the research into genetic diseases and what's happening?
Yeah, Scott, I'm going to answer this question, but very briefly, because of the question from Sana. Obviously, there is a personal interest in that question, and there might be a case. So I just want to reassure Sana that, we said earlier there are 7,000 known rare diseases, muscular dystrophies. There are about 22 of them, different ones. And if we are talking about Duchenne muscular dystrophy, there is absolutely hope for patients, because today we have 3 treatments approved for specific mutations. But there's also ongoing research that's quite advanced in gene therapy, which will most likely have a more curative or long-term impact rather than treating or managing the disease. We're going to start treating the underlying causes of the disease, and in fact, hopefully allowing patients to have more or less a normal life. And this is a very nice link to your question, Scott, because the most exciting about and what really gets me out of bed is really the advances in scientific research, and in particular with the advent of gene therapy, which is a culmination of decades and decades of research with setbacks and failures that we are now have today, entered the era of personalized, genetic, targeted treatments that actually have a curative effect more than, as we said earlier, managing these difficult cases and kind of, just alleviating a little bit the pain. This is the most exciting aspect of our involvement. We are at the forefront. We are on the lookout to see what drugs get approved through the pipelines. And our intention is really to make them available for patients that could benefit from them as early as possible after their approval. When I look at the gene therapy field today, there are about 3,000 drugs that are being studied in gene therapy. In fact, there are specifically 2,600 clinical trials for gene therapy solutions. This is going to be finally the big revelation that we have been waiting for since the mapping of the human genome in 2003. And this is probably the most exciting era to be in terms of treating rare diseases.
Excellent. Dr. Maryam, I'll ask you, again, looking ahead, what's the thing that's exciting you most right now?
Corona and the pandemic itself. It brought people, they always tell me, Maryam, you are always optimistic. I'm not optimistic. I try to look at the bright area of a picture. You cannot imagine, Scott, when we talk about Corona, the pandemic itself, if you go and recall the human history when it's come to science and medicine, there were no single time where all the well-known top scientists and an institute for clinical research, all of them, they come on one platform where nobody's competing, who can get the medicine in market faster and sell it and get the profit from that particular product. This was the first time ever where human and scientists and physicians came and talked to each other. As a physician, and later on I became a scientist, I recognize there is a big barrier between the physician who provide the service and between the scientists who invent and spend a valuable time to make sure that those product is available. Corona brought all those people together. And that itself, I believe, it is a door to heaven, in my opinion, for all the healthcare services and disorder to be managed in an excellent way where we can utilize all the resources, specifically the time and the money, in the right way. And instead of competing against each other, we can compete against the barriers and the challenges which we are facing. And on top of all, the suffering of our patient. And I believe the pandemic itself, it was an excellent lesson for all those big organizations and countries that they need to reassess and reprioritize and even change their approach in treating or managing any human challenge when it's come to health, to economy, and to social part. So again, I believe the pandemic helped and speed the whole process of advance in medicine and science. The right people are listening to each other, talking to each other in the same time, in the same place. And with the whole big data and the technology available right now and the connection between all these centers, I believe it is spared more than 100 years in a human life when we talk about any health science, any scientific advancement by Corona within 1 year, with all those newly acquired tool of communication and sharing. That itself, I think it will help us to build a very constructive, good approach to think about human suffering instead of thinking about our economy, thinking about how much money I will do as a company or as a private sector, or as a free zone or an institute with research competing who will take Nobel Prize. The pandemic taught us that we need all to listen to each other, talk to each other, and have the human needs top of all those elements which we believe are essential, and most of the time they are a hidden agenda when it's come to a very high level discussion.
I'm going to ask you very briefly, Dr. Maryam, as well, because Sana is following up with some questions. If people are asking, if people need advice, if people need help, where should they go? What resources are there? Should they be getting in touch with the UAE Genetic Diseases Association?
Yes. Again, when we talk about United Arab Emirates, we have a very unique setting. For example, we in UAE Genetic Disease Association, we are
Mhm.
so much focused on training and
Yeah.
awareness and education of service provider and collaboration with a big research institute and recruiting patients for those international clinical trials. And
Okay.
then we have another society which is taking care of the patient and their family, which called
Right.
UAE Rare Disease Association, and they are doing great on that side. So we complement each other. So if it is the need on the help of care and support for their patient, they need to approach UAE the Rare Disease Association. When it's come to treatment, training, and research, and trying to get any opportunity to be recruited in international clinical trials, it is United UAE Genetic Disease Association. And when it's come on the financial level, we have other societies who help a specific individual on case by case financially to support and cover the cost of their treatment and management.
Brilliant. And Sana, tuning in, thank you for all your questions. I hope that helps. And we'll try and get the team to get in touch with you and share some of the resources that Dr. Maryam has also talked about there. It's time to bring to close. Marwan, I'm going to let you have the last say. You were talking about fantasy as a child, and now you're living and seeing it on a daily basis. To close out the session, what's exciting you for the year ahead?
I mean, what's exciting is really what's happening on the diagnosis level. Today with so much information that we have had about ourselves through PCR tests, through, rapid tests, there's huge data that is being generated, and I think that can be used for many uses, whether it is clinical trials, whether it is for clinicians to be making, better decisions. But we need to also be worried about, the ethical part of the data and how that data is used. I think that is something very important as well. I think on the treatment side, things will continue developing as they are, whether it is for rare diseases or different types of cancer or other mental diseases, for example. That is something that is continuing, and obviously will continue in the near future as well. But I think what's important is how we were looking at pathologists in the past as, let's say, people who were never in the decision making, but now they're really at the forefront of the healthcare system, and I think they'll be playing a bigger role. So that's really exciting.
Thank you so much for all of your thoughts, and to all the people that have been posting in the comments. We're also going to get the show team to share that with the group as well, so we'll come back to you with any resources that we can there. Karim, Marwan, Dr. Maryam, thank you so much. Thank you for being on the Restart webinar and podcast. I am absolutely fascinated, and Dr. Maryam, I will reach out to you because I do want to know how old my hair follicles are and the rest of me, so that's fascinating. But thank you so much. Brilliant chat. I found it absolutely educational for myself, and all the very best. Thank you so much.
Thank you for having us.
Thank you.
Thank you. Stay safe, please.
You too.
Thanks.
Bye.